partake on an exciting educational journey related to public health theory, practice, and research. You shall discover on this learning adventure that the art and science of public health is both multi- and interdisciplinary in nature, very complex and broad, and continuously evolving over time. In this particular lecture, we shall examine the question of what exactly is program planning, implementation, and evaluation in public health. So, why is this significant? Well, in all healthcare organizations and systems, decisions are made as to how resources, healthcare personnel, and technologies will be utilized to address projected healthcare needs in the future. Indeed, with increasing scrutiny, demands for transparency and accountability of how public health funds are being utilized and spent, program planning, implementation, and evaluation are critical to address both current and emerging public health challenges and issues across the lifespan. One could also argue that it is also critical to promote social justice. Social justice, as a society, gives individuals and groups fair treatment and access to healthcare resources, services, and an equitable share of the benefits of society. Significance continued? Well, public healthcare professionals and workers, of course, must work in partnership with other healthcare providers, citizens, various organizations, families, community stakeholders, and various levels of government during the program planning and evaluation process. Indeed, there are no so-called professional silos in public health. Public health, by its very nature, requires inter- and multidisciplinary collaboration amongst public healthcare professionals and workers, and also intersectorial collaboration between all identified stakeholders. So why is program planning essential to public health? Well, with planning, we seek to make informed decisions today based on the best available evidence to influence future health outcomes and directives based on competing resources and or priorities. For example, if you were interested in planning a trip to the moon, the International Space Station, or even Mars, one can see why it is essential to plan and to also prepare for this journey. The same is true for public health. So what is program planning? Well, program planning is defined as an organized and structured, systematic decision-making process which attempts to meet specific primary healthcare aims or objectives through the application of currently available and competing or needed resources in the future based on identified priorities or projected needs. Program planning is similar to the strategic game of chess, where chess players have to carefully plan each of their moves and weigh the costs and benefits of each to ensure success. And program planning in public health is very similar. So what are current and predicted needs and priorities? Well, they may be either situational or reactive in nature, so let's provide some examples each to clarify these concepts. A situational need or priority includes such things as an aging population and various trends for aging in Canada and internationally, and the associated increased incidence of non-communicable diseases such as diabetes, stroke, heart disease, and cancer. Reactive examples include such things as the SARS pandemic, Zika virus or Ebola virus outbreaks, avian flu, or a scarlet fever outbreak in Hong Kong as shown here. So let's provide an example for strategic planning in terms of pandemic preparedness from a public health perspective. Well, during the 2009 H1N1 pandemic, there were 428 associated deaths and 8,678 hospitalizations in Canada due to this pandemic. Subsequently, public healthcare professionals and policymakers and various community stakeholders got together and developed the Canadian Pandemic Influenza Plan. And its objectives here was to minimize serious illness, to prevent mortality, and also to prevent social disruption during such outbreaks and pandemics. What is operational or activity planning? Well, we define these as a formalized decision-making process which focuses on the implementation of plans based on detailed timeframes. For many planning systems, both short, medium, and long-term outcomes may be identified. What is short-term planning? Well, short-term planning is typically less than 1 year in duration, and they comprise the immediate and apparent needs or challenges facing a community or region, such as the need for a community-based immunization program to prevent the spread and containment of a measles outbreak. Medium-term planning is typically greater than 1 to 4 years in duration. An example here might be reducing the incidence of attempted and successful suicides in an Inuit community located in Nunavut, Canada, over a period of 2 to 4 years. Long-term planning is typically greater than 4 years in duration, but it may also be several decades in duration. For example, you may want to decrease the incidence of homelessness and poverty in a community or region by increasing the availability of various social safety nets, such as unemployment or old age security benefits, and also the availability of affordable housing for all. What is evaluation? Well, evaluation is best understood as a process ultimately intended to determine the worth of something new, presumably in comparison with some current norm or standard of goodness. Well, the current so-called gold standard in public health is making the majority of clients feel better in every respect associated with their health and well-being. And this also includes the associated cost for delivery of these healthcare services. So here we have an example of a school-based health promotion program which seeks to encourage youth aged 12 to 17 to become more physically active in nature to help prevent the development of non-communicable diseases as adults based on Canadian Society for Exercise Physiology recommendations. In fact, currently 94.4% of 12 to 17-year-olds in Canada are not meeting these current guidelines to engage in moderate to vigorous physical activity for at least 60 minutes a day. In other words, less than 5% are meeting these target recommendations. Hence, youth who are currently inactive are at increased risk for developing various non-communicable diseases, including heart disease, stroke, and diabetes, and certain forms of cancer as adults. Wait times for common surgical procedures in Ontario, for example, may be a marker here. Common surgeries may include cataract eye surgery, hip and knee replacements, cardiac surgeries, and angioplasties. What is program evaluation? Well, we define program evaluation as a formalized, ongoing, and dynamic process to monitor, assess, and refine public health program activities and interventions, and to identify gaps or actual or potential flaws in the original program design and implementation. Moreover, current interest in so-called results-based financing in healthcare is putting increasing pressure on both private and public healthcare funders and implementers to carry out formal program planning, impact evaluations. So what are the various types of program evaluations? Well, there are three main categories, which are typically based on when the evaluations are being conducted and the type of information being collected. The three types are formative, process, and summative, and we will examine these in greater detail. So formative evaluations focus on public health programs that are being planned and developed to help ensure that the stakeholders' needs are in fact being addressed, and that the program uses effective and appropriate structures, resources, facilities, procedures, and or materials. Formative evaluations include such things as conducting a needs assessment, use of program logic models that are widely employed in public healthcare facilities across Canada and abroad, also the pre-testing or piloting of some program materials or educational resources, such as new websites or pamphlets, a preliminary analysis of to ascertain if your program's intended aims or goals or outcomes can in fact be achieved, measured, and evaluated. Take, for example, a community living near a nuclear power plant. You may want to increase knowledge to residents of how to react to a nuclear emergency and what to do, including how to avoid exposure to radiation, evacuation procedures, where to seek safe shelter, and the use of RAD block here, which is a potassium iodine tablet, thyroid blocking agents that is employed in nuclear emergencies. And these can be distributed to your residents in the community, and they can place it in a safe place in their home where they can easily access it in case of a time of need. The term structure here is often used to describe all the resources and personnel required to support this particular process. Process evaluations focus on programs that have gone through the formal planning stages and have been implemented or are already underway. It seeks to answer the question, what health services are actually being delivered and to whom? Hence, a process evaluation focuses on the specific tasks and procedures necessary to carry out the program and includes a variety of activities, including the implementation sort of evaluations, quantity and quality of public health services rendered and to whom I should say, descriptions of the users and who is actually accessing these services in a defined region or community. You may want to evaluate, for example, a newly developed tele or e-health service in a region or province in Canada. Summative evaluations are carried out for health programs that are well underway or have been completed and can be used to assess short, medium, or long-term goals or desired outcomes of the program, both intended and unintended. Hence, summative evaluations seek to answer various questions such as, did the health program make a difference? Did the health program meet all of its intended aims and goals? A soup analogy that was first put forward by Robert Stake. And it states that when the cook tastes the soup, that's formative. Whereas when the guest tastes the soup, that's summative. So this analogy is a clever way of remembering what is formative and what is summative types of evaluations. What are outcome measures? Well, an outcome measure evaluates what specifically occurred as the result of the health program being implemented in reference to its noted aims or goals. The terms outcome and impact measures are often used interchangeably, but are distinct entities when conducting summative evaluations. For example, the impact of anti-smoking policies, legislations, and community health promotion programs on prevalence rates of smokers over a defined period of time. By contrast, what are impact measures? Well, impact measures are used to evaluate the effect of the implemented health program on the users, stakeholders, and implementers, and specifically measures what changes. Is it positive, is it negative, or neutral in nature as a result of the program? Importantly, satisfaction may or may not always be a good indicator of the program's success per se. For example, consider parents of teens who are not very happy or satisfied about the availability of condoms in high school washrooms in a defined community, or their open display in pharmacies, although their use have been demonstrated to decrease the incidence of unwanted pregnancies by teens and also the incidence and spread of STIs in the community. So what are health indicators? Well, indicators might be, for example, public safety behavioral changes, a variety of health-related quality of life measures, health-related policies, participation in community-based physical activities, population or individual health status, and the use of resources and the like. Who are stakeholders? Well, stakeholders are defined as all individuals or groups, and they can be either internal or external in nature, who have an interest in the program, or those who may be affected by the program either directly or indirectly. And they can include individuals such as community volunteers, potential program participants, policymakers, governmental agencies, non-governmental agencies, or industry. So let's provide an example of why it is important to always consult community stakeholders. So in this picture here, you see a converted ambulance from Copenhagen, Denmark, and it's known as a fixulence. And this was really the first safe drug consumption room, or DCR. It was mobile in nature. It can go to various locations in the city, where healthcare professionals could supervise IV drug users and also provide them with various health information and referrals and so on. So community stakeholders in this process were consulted about their needs, and there was an identified need related to associated IV drug use related to the higher incidence of STIs and blood-borne diseases such as hepatitis B. 8 steps in the program planning, implementation, and evaluation process. Well, we will examine these 8 steps in greater detail in the subsequent slides. In addition, I want to bring to your attention that there are also a variety of models that have been developed and are detailed in the literature. For example, the program logic models that are widely employed throughout Canada in various healthcare institutions and abroad. This particular process, the program planning, implementation, and evaluation process, that is to say, is similar to the research process because it involves the collection of data, its analysis, and the dissemination of findings. So we will examine these steps in more detail. So step 1 involves conducting a needs assessment. And this helps to formulate a clear understanding by all stakeholders and implementers as to what the actual or potential needs, problems, or health-related issues are that need to be addressed to positively influence health and well-being in a defined community or region. Right? It might be simply the identification of an intersection that is not safe for pedestrians and cyclists. What are actual problems? Well, actual problems are defined as those that currently exist in a defined group or community. For example, there may be an actual problem or a growing need related to a lack of community-based end-of-life palliative and hospice-based services due to aging population trends in Canada. What are potential problems? Well, potential problems are defined as those that may occur at some time in the future. For example, sedentary and overweight children and youth who develop hypertension, cardiovascular disease, and diabetes as adults. It is noteworthy that approximately 1 in 3 children in Canada are currently overweight or obese. So this has potential implications in the future for the development of these non-communicable diseases as adults. So step 2 of this process involves the articulation of specific program aims and goals. While these should be clearly measurable in nature, and those that are not specific should be clarified before proceeding. One way that may help you to write better program aims and goals is to use the SMART acronym, which stands for S being specific, M, measurable. Are these in fact measurable? A is attainable. R is relevant to all stakeholders. And of course, T being time-bound, to put time dimensions onto them. We have to articulate aims and goals, and here's an example. We have to crystallize what the program's intent is. For example, we want to decrease the incidence of type 2 diabetes. For whom? It may be young adults, age 18 to 40, living on First Nations reserves in Canada. Who will implement the program? It might be public healthcare professionals in concert with community volunteers and First Nation healers. Step 3 involves the development of a draft program plan. And this is based on a critical review of the best available evidence and the current state of knowledge related to the actual or potential problem or issues identified. Now, the best available evidence could come from a variety of sources. It could be published reports, it could be best practice guidelines, or it could be from community stakeholders themselves and frontline workers, including individuals such as Aboriginal healers, for example. So here we see a draft program planning question example. And that might be a very handy way to proceed by asking questions and seeking the best available evidence to answer that question. For example, what is the current state of knowledge related to cosmetic pesticides and the development of skin rashes, neurological disorders, and cancer in our community. We want to make our action plans evidence-informed. Action plans should be evidence-informed, and each proposed intervention of the program needs to be carefully detailed. Many kinds of action strategies can be considered or created, and of course, imagination is an essential ingredient for success. Plan of action. Look at the plan of action, or consider it as sort of a blueprint for the construction of your home in the future. And you want to detail in this blueprint where all these support beams will go, the electrical wiring, the plumbing, the size of each room, and the timelines for completion, and so on. The more detailed the blueprint is, or action plan if you wish, and the better it will be understood by all, and the more likely it will be successful. Task development timelines specify tasks that or activities that need to be completed and the time frame in which the tasks are estimated to be completed by. They can usually be short, medium, or long-term in duration. It may be a good idea making a timeline that is optimistic in nature, and also having alternative timelines may be wise. Flexibility is needed in combination with goal-directedness. What are Gantt charts? Well, they're typically depicted in a tabular format and are a commonly employed visual tool to present the sequence and timing of tasks or activities that must take place in order to accomplish the specific objectives or aims of the program or project. So here we see a Gantt chart example. We see on the left-hand side some major tasks that want to be completed. Number 1, to develop a pilot program rationale. Number 2, to conduct a needs assessment for all stakeholders concerned, and so on. And we see the timelines here depicted in months from January to December. The X represents the planned time frame, and the XO represents those that have been completed. The 3-star marker under April is the marker for the current date or time frame. Hence, a Gantt chart provides all stakeholders and planners with a visual aid to monitor tasks that have been completed and are underway, and the progress made on a regularly scheduled basis. Step 4, seek feedback and suggestions. Well, you have to keep in mind that communities and groups work from their own unique values, experiences, and their own definitions of their situations. And public healthcare professionals and workers need to be supportive of these. Effective communication emphasizes the need to find a common language and ground which recognizes the interdependence between stakeholders and public healthcare professionals and workers. Feedback may occur in a variety of formats. For example, you may want to conduct town hall meetings, focus group meetings, targeted emails, etc. Step 5, refine action plan, model, or design based on feedback. This information may be utilized to help clarify program aims or goals, target populations or users, resources available or needed, definitions of actual or potential health-related issues or concerns, action plans and timelines, and or evaluation tools or methods. So feedback may occur in a variety of formats. For example, maybe you can conduct a town hall meeting, you could have focus groups, you could have targeted emails, etc. For example, programs involving the use of community volunteers as resources are becoming increasingly popular way to help contain costs and also to encourage the establishment of community partnerships and participation. Step 6 involves the implementation of the program. So once the program is implemented, it is also critical to carefully monitor and assess the program on an ongoing basis for unforeseen events or circumstances that may be negatively impacting on the overall success of the program. For example, there may be a labor dispute, which would hinder clients' access to certain healthcare services or facilities. Step 7 is evaluation. This step involves the formal evaluation of the specific program aims or goals. An evaluation here is based on the documented outcomes achieved and an analysis of the qualitative and or quantitative data collected. Step 8, which is the final step in this process, involves the dissemination and communication of findings. This step serves as a vehicle for providing feedback related to the program findings and outcomes achieved to all stakeholders and implementers in reference to the program aims or goals. Although formal documentation of the evaluation process is often a requirement for various health programs, informal mechanisms may also be employed. So a variety of forums may be utilized and employed to provide feedback to stakeholders and implementers, including town hall meetings, the use of mass and social media, maybe perhaps a website developed for the program, public health reports, conferences, and of course peer-reviewed journals, to name but a few. Here's 2 additional suggested readings related to program planning, implementation, and evaluation that may be of interest to you. Well, that's all, folks. I want to take this opportunity to thank you for listening to this mini lecture, and I hope that you listen to other lectures in this mini lecture series related to the art and science of public health. Cheers!